Hello, and really warm welcome to November's Chief Exec Shout Out. I'm here just outside our new REI modular theatres, and I'm going to be talking to the clinical lead in a moment about those developments. But also this month on the Chief Exec Shout Out, we're going to meet a few other people who'll be able to talk to us about the importance of our staff and development that we're doing with all of you, and also our international nurse recruitments. So now we're inside the new build that I showed you a few moments ago, and we're in one of the consultation rooms, and I'm really delighted to be joined by Tomas Cudrnak, who is one of our ophthalmology consultants. And Tomas has been part of the leading team to develop the Accelerator Recovery Program. So Tomas, welcome to Chief Exec Shout Out. Tell me a little bit about this building, what it's here to do and what's happened so far.
So this is the first step in this program. We're trying to accelerate delivery of ophthalmic services, but as a part of a bigger picture, like all the services in our trust. And at the previous location, which was on the 7th floor in the main building, our theatre capacity was not sufficient, because there is a shortage of theatre capacity across the whole hospital. So the number of sessions we were delivering dropped to about 14 sessions per week instead of 20. So we really welcome the opportunity to have more space, more time to perform surgery, especially in these hard times when the backlog has grown to a quite a big level during this COVID pandemic. Hence, the hospital agreed to provide, as a first step, modular build outside of the hospital on a car park. It's a high-quality build which offers our 2 theatres to be used Monday to Friday. So we increased capacity from 14 theatre sessions to 20 per week. But this is a very good step forward towards meeting expectations of our patients.
I mean, it's really exciting, isn't it? Because I think all of us have been very worried about the backlog of patients that's inevitably built up over the pandemic, and we really want to make sure that we get those patients treated as quickly as possible. And I think we've been very successful across Devon, because we've got here for the Royal Eye Infirmary and the theatres here, but we've also got an Accelerator Recovery Programme up in Exeter using the Nightingale Theatre. So tell me just a little bit more about the types of patients that get treated here, because although you deal with eyes, there's still a lot of risk, isn't there, for those patients? And then what's going to happen next? Because this is the first phase of what we're doing. What can we look forward to next?
So, first about here, so these 2 theatres, one is delivering a high volume cataract surgery, as high as you can deliver in this modular setting. Because one has to remember, this was built within 4 weeks of starting, so the plans were about the same when you compare to converting Exeter Nightingale Hospital, but this trust achieved something which is difficult. In 4 weeks in August we opened. So the Exeter is still not open, we are already open, delivering excellent care. So there's one theatre will be purely for cataract surgery, where we hope to deliver somewhere between 60 to 80 surgeries per week. The second theatre is more subspecialty theatre, mostly vitreoretinal surgery, retinal detachment, more urgent type of surgery, corneal transplants and oculoplastic surgery. However, 2 theatres at this time are good for now, but not for the future. Hence, this is part of a larger program, and in a second step, we're gonna open a newly purpose-built Royal Eye Infirmary, which should be behind Range, very close by, very short walk, and that will be over 3 floors, and the bottom floor will have 3 purpose-built ophthalmic theatres, 1 for high-volume cataract service and 2 for subspecialty services. Because there are not only backlogs in cataracts, even though they are the largest, there are certain subspecialties like oculoplastic surgery, orbital surgery, corneal surgery, where the backlogs are very not large, but patients need to wait long, and this is across the whole region. So we're not only going to be providing an excellent service locally, this is about supporting the whole region as we're significantly increasing the subspecialty, which have 12 to 18 months waiting times for surgery across the region, particularly squint surgery and oculoplastic surgery. So it's a huge development which not only offers larger capacity, but the premises are going to be better waiting areas. There will be a specific large waiting area for children. So pediatric eye services are gonna see immense improvement in a way of waiting, the number of examination rooms and the services which will be provided. So we are extremely grateful that this development is happening, and I do believe we will become probably the best eye department past Bristol, because Bristol Hospital is much larger.
I think that's lovely, and what a great beacon of hope, and how lovely it is to think about the development of services that are fit for purpose for children. That's part of our job, isn't it, in terms of making sure that we're able to serve the children's population really, really well. And this is in response, isn't it, to the growing demand that we've got out in our local communities and population. And it really helps us think about the new hospital, how we future-proof that, but also the services that you and your colleagues provide need to be close, but they don't need to absolutely be on the main hospital site. So I think we've got a real win-win situation. So thank you very much, and perhaps we can come back and see how it's been going in a couple of months' time. Thank you, Thomas.
Thank you very much.
So I'm really delighted that for the November Chief Executive Shout Out, we're going to just talk to 3 colleagues who've been instrumental in something that I feel is very dear to my heart, and I know across the Trust. And this is the work that we've been doing around international recruitment, specifically for our nursing colleagues. And this is really important because we are part of global citizenship. And I think making sure that we have got a really diverse community and that we can celebrate and learn from each other is one of the founding principles and values of what it means to work at Derriford Hospital. So I'm really delighted that I'm joined by Darryl, Gary and Nithiya. Really, really lovely to talk to you today. So Darryl, let me just start off with you. Tell me a little bit about the programme, how it works, how long it's been up and running, and how it works throughout the pandemic as well, because that's been quite tricky, I would think.
It has, yeah. The programme was put together back in September 2019 to try and fill recruitment gaps for the Trust. So it initially started by recruiting through Yeovil, but we've now moved into the Devon hub, and we recruit through them since September this year. During that time, like you said, the pandemic happened, which proved some challenges, but we managed to follow the government rules, and sometimes that meant that nurses flew into the UK and had to isolate in hotels in London for 10 days before they could travel to us, and others, because they came from amber countries, are able to be accommodated in our own accommodation and self-isolate, self-contained flats within that. When they come out of that, obviously we continue to make sure we follow COVID guidelines, and we included them in the lateral flow testing, of which they have to do before they sit their OSCE exams anyway. So we deliver them with their lateral flow tests as well as having PCR tests for the 2 and 8 days while they're in isolation.
So, I mean, it's amazing that you've been able to continue that programme throughout the pandemic, albeit with those extra safeguards that we know have had to be put in place. But this is a really important part of our recruitment programme, isn't it? So what other support do we offer our global colleagues as they come to work for us?
Okay, so my role is basically pastoral support for them. So that starts from the moment that we know they're coming to the UK. So the team, of which there's 3 of us, there's myself, Josh, who does a lot of the admin for the team, and Tanya, who looks after all the accommodation side for us. We speak to them regularly, give them updates, give them information about coming to the UK, what they need to do that. And then Josh and I go and collect them from Heathrow Airport. In fact, we've taken 17 11th of this month, so we'll be going up to collect them and bring them to our accommodation. They come down to the accommodation, we provide a food package, bedding, phone cards and Wi-Fi access, and we keep in contact with them while they're in isolation, make sure they're okay, make sure they've managed to contact home, keep them up to date with events like the programme that they're going to enter into. And when they come out of that isolation period, we deliver a 2-week induction package, which includes trust induction, but also things like living in the UK, orientation to Plymouth, and as part of that package we also make sure they can open bank accounts, so we book their bank accounts, appointments, we get them their biometric resident permits from the post office in town, take them down to that. We introduce them to Wells food shops in Plymouth, and orientate them to where local church is and other activities are that they might be interested in.
Wow. It's a lot to think about, isn't there? And that sounds really, really supportive. And I think making sure that we support colleagues to make that transition, which must be really difficult and disorientating, as easy as possible, is really, really important. So perhaps I could just turn to you, Gary. Just tell me a little bit more about why this programme is so important for our recruitment. How do we support people on the wards, and how does that work? And then tell me a little bit about this exam that people have to do as well.
So for all of our international nurses coming over to the UK, in order to register with the NMC, they have to pass a test. There are 2 parts to the test. First part is done in their own country before they leave to ensure their English is good enough to come over here. And the second part, once they're over here, is sat with us. So they go to the NMC and it's all skill based. So we run a 3-week intense educational programme to prepare the international nurses to sit that exam and pass it and then gain their NMC registration here. So it's a lot of hard work. We've got 4 educators and trainers within the team. 2 of them are international nurses as well from previous cohorts at the beginning of the recruitment process. So that's a great support for our new recruits coming through. And then support-wise, once they're on the ward with their PIN number, we then put them onto their preceptorship programme, which we also run, and that's a 6-month supportive programme for their transition to ensure they're well supported on the ward.
That's lovely. Thank you very much. So perhaps, Nithiya, I can turn to you. And you were from cohort 4, I think, which is lovely. So just tell me a little bit about what your experience is like being one of our new colleagues, or not so new now, from international recruitment.
Yes, as you said, I came as a 4th cohort Delta in 2020 January. I felt like as a group, we all felt really supported, start from the beginning itself. As Darryl said, starting from the London airport itself, we could feel that one. Yeah, throughout the program, we got proper enough support and good orientation. Especially from the Plymouth culture, and also throughout the hospital we got a good induction in the initial week, then only we joined the OSCE program. So it was really helpful in the initial.
Great, that sounds really, really good. And how many cohorts are we up to now? If you were in the 4th, what are we up to now?
So the cohort just coming is cohort 26. That is a total of 226 international nurses and 15 radiographers we've recruited so far.
That is fantastic, isn't it? I think it's something that I really, really enjoy about the Trust, because I think it just adds to our diversity and our richness, and I think we are absolutely the better for it. Tell me a little bit about your other experiences as being a nurse, and how does it compare to what you've been doing here?
Yeah, in our country, there is a lot of difference we can see, especially in the culture-wise, there is a lot of differences, and also as a team also there is a lot of difference. Especially in a team, we can definitely see the equality here. We all see all people, whatever their level of doing their job. We all consider each other equal, and given the respect that is very appreciable.
That is lovely, lovely to hear. So thank you. Wish you all the best for the future, and thank all of you. I mean, I think it's just so important that we've got this programme. And I think the support that we want to give all of us across our teams is really part of what Derriford is about. And I think the way that the team have described it has been really, really brilliant today. So I'm sure this will continue to be such a key component of our recruitment strategy, and really important that we make global colleagues feel welcome and supported, and that we learn from them as well. And I know that's something that myself and the Trust Board are really, really committed to. So I'm really delighted to be joined by Claire Underdown, who heads up all of our OD and does a lot of work with our colleague engagement. And we know across Derriford Hospital our staff engagement and support is so, so important. It is the bedrock of everything that we do. And I think we'd all recognise at the moment that everyone is under a huge amount of pressure, and this has been going on for a little while. So Claire, really warm welcome to you this afternoon. Just from your work, just tell me, how do you think staff are feeling at the moment, and what are we doing to support them?
Thanks, Anne. I would really reflect what you've just said in your intro about how hard it is for people at the moment, and I think the toll that it takes in terms of the length of time as the pandemic continues, and just the huge amount of work that people are undertaking every day, that reduces our resilience to how we can respond to situations. So it's really important, I think, at this time that we look out for each other. And what I'm hearing, I think, most from staff is around when it feels really great is when they come together and they get support from their teams, support from colleagues, they get reassurance when things feel really difficult, and that sense of team and having time together and looking after each other becomes really important. And I think maybe trite to say unprecedented, but I suppose these are times when we don't know the answers to things, and we're having to live with more uncertainty in our lives generally, and that's really hard for people, for all of us.
Yeah, I think that's absolutely right, and I like to spend as much time as I can being out and about. And you know, I'm always hugely humbled about how professional, committed and resilient people are actually, because they keep turning up, they keep doing a great job and really care about each other and our patients. And I know that we've put a lot in around general health and well-being, which is really important. I suppose my question to you is it enough? Because this has got, you know, this sort of situation's been going on now for over 18 months, and we do what we can. We send chocolate out, we've got health and well-being packages. What else do we need to be doing to support colleagues?
I think that's a really interesting question, because you're right, we do have a lot of support available to our people. Some of that, which is absolutely fine, requires people to go and maybe look on the website, find our Wellbeing hub, have a look at the support that's available there, and we know that works really well for people. So things like access to our employee assistance programme, where there's 24-hour support for people to use a phone number to have a chat with somebody who can support and help them, through to counselling and coaching, etc. And all of those we know are really helpful interventions. But I suppose we've been thinking a lot about what does really help on a day-to-day basis, and we, I think, know that help close to the team and close to the individual is what's really, really appreciated. So how can we bring that support as close as possible to the people who need it? So there's lots of initiatives that our occupational health team are undertaking around helping people to, you know, maybe take part in different wellbeing type sessions. But one of the things we've been looking at is our idea of a people champion. So we've it's an initiative we've just introduced. So we've got 25 people champions who are just undergoing their training, and they cover well-being, they cover freedom to speak up and inclusivity. And the idea being that these are going to be people, first cohort obviously 25 will be a start for us, but we want to grow that, so hopefully all teams will have some input from a people champion. So somebody within your team who has some training to help signpost the available support, has some skills in an initial conversation. So it might be just somebody needs a conversation with somebody. It's not in a management structure, but it's just somebody who's able to have that conversation. So I think that's a really exciting development. We've also got a psychologist who's going to be working with us, who's just about to start, who can work alongside that team as well.
So it's 25 to start off with.
Correct.
And so 2 questions then. How are we going to support them?
Yes,
because they could be
absolutely.
taking quite a load. And what's the ambition? How many are we hoping to get, or are we
Yeah.
going to evaluate it
Yeah,
first?
I think a little bit. So in good improvement practice. So we're going to test and see how this cohort goes. So I think in terms of support to them, one of the things is going to be around, obviously it's a new role, so we will be taking feedback and understanding how it works. So I suppose kindness to our colleagues who are stepping forward to do that. We're going to support them with some training. So they're going to get some skill booster training in things like how they give feedback, how they handle some difficult conversations, how they deal with people who are perhaps in distress. We're also going to give them some development on helping them to recognise all of the stuff that's available for staff, so they become good signposters for things, because one of the things we know that it's really hard to know what you don't know, and so they're going to be really vital in helping people to reach out. And we haven't set an exact number, but I suppose aspirationally to try to get to a point where we've got somebody within a team would be really helpful. And the idea that we'd end up with a page of our intranet where you can go on, look at all of our people champions and find somebody. So you could either approach the person in your team, or you might think, I feel really comfortable in going and talking to that person who's a people champion.
I think that sounds really, really exciting. I think what you're really saying is that we're there for people, whether that's through people champions, freedom to speak up, your line manager, whatever you are feeling, however it is, we're there for you. We want to hear from you. We want to support you. And they're all the things, aren't they, that are available in the moment. But I always like the time when we have our staff survey as well. And it must feel really hard for colleagues to just take 15 minutes out, have a cup of coffee and complete their survey. But what we really want to say, I think, to staff is, those 15 minutes and your reflections really, really do help us think about what we're doing well and what else we need to do to really make sure that despite the context we're working in, all the pressures, what can we do to help people really want to stay working here? What's your sense of why the survey is so important?
Yeah, definitely. And I think it's really important because it's a piece of our jigsaw, and it's a really important piece, but it helps us from a really strong data perspective understand our biggest exploration of staff experience in the organisation that gives us data that we can work with. So it's really important from that point of view. I suppose at a higher level, it's one of the biggest staff surveys in the world, and we get a chance to take part in that. So, we get to give our feedback to the national picture of what it's like to work in the NHS. So I think that's important. But I would say predominantly locally it's important on a couple of levels. One, because it's a chance for a team to understand how they're working, and sometimes we don't take time to take stock and think about how our team's working. Our staff survey data doesn't give us all the answers, but it's a really nice way of starting a conversation about how it feels to work in my team and how it feels to work in my colleagues. So I don't think it's about it being in any shape a sense of marking your homework as a team, but it's a start of a conversation to say, that's really interesting why we all felt that. So one of the things we really encourage teams to do is to come together, not in a very formal way, but to try and really understand, okay, so look, a lot of us really felt this. What does that mean? And have a conversation about it. And if there's then something that the team can change as a result of that, because often people say to me, nothing ever changes with the staff survey. Well, actually the change starts partly with us at a local level and understanding. Clearly there's things that we know influences decisions that the board make, for example, that come directly from our staff survey. So really looking at investing in our psychological support for staff. We really heard in the feedback during the course of our COVID year particularly, the value in understanding burnout, how we support people, what's most needed, and some of the psychological support that we're putting into place via our psychologist is really going to help with that.
Sounds brilliant, and I think what we'd want to do is encourage all colleagues to complete their staff survey. Every team's got something that they're doing well and positive. We'd really want to celebrate that, but we also want to know about how we can improve, and that feedback is really, really important. important. So Claire, thank you so much, and thank you for everything you're doing, and I look forward to hearing a bit more about the impact of the staff champions.
Yes,
thank you.
Definitely.
Great.
You.
So just to round off on Chief Exec shout out, just to let colleagues know that we've had CQC in, I think, 3 times within 4 weeks. Just want to say a huge thank you to you. I know, because I've had the feedback, that you've been open, you've been proud, and you've really shared openly with colleagues from CQC about what's going well and what some of the challenges are. And I'm pleased to say there have been no surprises so far in the feedback I've had. So although we've got challenges, I think we know what they are. I think we're doing our very best to pull together to make sure that you're supported and that we get patients treated. As soon as I get a bit more information and the draft report, which I think will probably be with us mid-December, I'll obviously share as much of that as soon as I can. So finally, thank you so much for everything that you are doing. I couldn't be prouder to be part of the team that is Derriford Hospital. Thank you, take care, and talk to you all soon.